when one of these accidents happens, like the Fukushima accident, of course there's substantial misunderstanding of what can and can't happen. This is not a nuclear explosion. There are explosions, but they are of conventional type. And we have releases of radioactivity. So of course our first attention is on the possibility that either workers or rescue personnel may, for some reason or other, like in Chernobyl, be exposed to extremely high doses, and that will require an intervention, a medical intervention, a major league medical intervention. But that usually doesn't happen, or if it happens to very few persons. And fortunately at Fukushima, it really hasn't happened to anyone. So what are the risks to the workers who were at the plant, who were the first responders, who, fortunately, we have considerable data on what their exposure was. Not perfect, but considerable data on them and on what are now about 20,000 people that are working at the plant to mitigate the accident. But if I focus on those receiving the highest dose, these doses are important, but again, they have to be taken in the context of the fact that any one of us has a 50% chance of developing cancer in our lifetime. So how much do these doses add to that risk? Well, they do add something. I mean, we don't want to expose people to any dose of radiation that is not in their benefit. There isn't some reason for it. But these fellows were acting in a way that is intended to save the lives of others. And so that's a permissible exposure. Does it increase their risk of cancer more than smoking a pack of cigarettes a day? No. I mean, smoking a pack of cigarettes a day for your lifetime is going to be much, much of a greater risk to your health, to your likelihood of getting cancer, than even the highest doses of radiation that were received by the Fukushima workers.